Hi, my name is Lacey, and I'll be doing my case report today on intimal hyperplasia of the common carotid arteries. I had help from two technologists in my lab, Rhonda and Jennifer. Intimal hyperplasia of the carotid artery is a healing response due to injury to the blood vessel wall. It is commonly seen after vascular surgeries such as endarterectomies, stent placement, or ballooning of the artery. An endarterectomy is performed to clean the arteries of fatty deposits and plaques that build up over time and can eventually cause narrowings that could restrict the blood flow to the brain. In worst case scenarios, this could result in a stroke. Sometimes this is the only option to remove the buildup that has occurred over the years. However, the endarterectomy can cause injury to the vessel wall. The injury will then trigger the hyperplasia process to occur in the innermost layer or the tunica intima. The injured endothelial cells produce inflammatory mediators that trigger platelet aggression, fibrin deposition, and recruitment of leukocytes to the area. This process will typically occur over a few months' time and can cause restenosis of the area. Our patient was a 75-year-old man. He presented to the vascular lab for his routine yearly carotid artery duplex ultrasound. He usually has his ultrasound done in Florida, where he visits for the winter. This year he visited his family physician, and he heard a bruit on the left side. The patient denies any symptoms that would suggest carotid artery disease, such as numbness, weakness, trouble speaking, confusion, ischemia, dizziness, or headache. The patient history reports he is currently a 1-pack-a-day smoker being treated for hypertension, hyperlipidemia, atherosclerosis, and COPD. The patient has history of common carotid artery stenosis, which resulted in endarterectomy, and he thought that had occurred in 2006. Our exam showed significant intimal hyperplasia noted at the distal common carotid artery or proximal endarterectomy site, causing elevated velocities. The patient was scheduled for a carotid angiogram the following day, and the vascular surgeon reported that there was a 50 to 60% stenosis of the distal common carotid artery. Surgeon decided on no intervention at this point. Patient is to continue antiplatelet therapy. Also was advised to continue lipid-lowering meds and control blood pressure, and be scheduled for a follow-up carotid artery duplex exam in 6 months. Often with neo-intimal hyperplasia, the thickening of the artery wall occurs. Injury of the endothelium during surgery causes platelet accumulation of endothelial regeneration and proliferation of smooth muscle cells. It can result from endovascular procedures, and it is not uncommon to find after stent insertion, angioplasty, or around long-term catheters, even at graft anastomosis sites. Restenosis 3 to 12 months following angioplasty is most often caused by intimal hyperplasia. Hyperplasia could be wrongly diagnosed as heterogeneous or anechoic plaque. In the beginning stages, it looks more anechoic. As it ages, the plaque, it's the same as how the echoes will age. When the process is in the beginning stages, it could also be mistaken for a fresh thrombus. Despite many advances in technology and sonography, they haven't been able to come up with a good treatment or prevention for intimal hyperplasia. Limiting the amount of injury to the lumen during surgery is the best way to reduce the amount of thickening in the artery. In many cases, hyperplasia can lead to restenosis of the original and or new sites. A stent is sometimes placed to hold the area open, but that can also trigger more intimal hyperplasia to occur. There are many techniques being tried to reduce hyperplasia, such as low-dose heparin, warfarin, angioplasty, ballooning, and intravascular brachytherapy. In this case, we used duplex and Doppler imaging to evaluate the carotid arteries. Sonography was used to assess the patient's carotid artery health, and the study provided essential information for further intervention and treatment. Most intimal hyperplasia occurs following a vascular procedure, but can end up being significant enough to restenose or re-occlude the arteries. There aren't many known treatments or prevention when it comes to this type of thickening. I will try to zoom up and show you my pictures. They show very limited flow. I don't know how well you can see. You can see that this plaque was in its beginning stages, very anechoic, few echoes, but you can also see the absence of blood flow in this area. This is a long picture of the distal common carotid artery. And then, this picture here is a transverse of the common carotid artery, and you can see that the lumen is partially filled with color flow.